What do you think are the gaps in Benton County's addiction prevention, treatment, and recovery system of care? And what can Benton County do to improve that system?
As a retired social worker, I've worked with families and children at risk, developing case plans and continuum of care programs in order to provide a safe and sustainable care for the children at risk of abuse or neglect. Many times our efforts fell short due to a lack of resources, and it was the children who suffered most since it slowed our ability to provide a permanent plan for the family and their children. It was at times like this that a creative case plan could provide clarity and direction. So I applaud the county in opening the Benton County Crisis Center as a new resource to meet the needs of our community. I also want to note that Judge Demarest resumed the Adult Treatment Court program in her circuit court to address the systemic causes of criminal behavior, which usually stem from drug abuse. But even with the new programs, the county has gaps in funding and staff resources to adequately address the growing needs. I would commit to seeking sustainable sources of funding that would support expanding treatment resources, staff, and continuum of care programs. I would also seek the expertise and knowledge of our existing nonprofit service providers to assist in identifying additional gaps in services and recovery care programs to augment how the county can reach more residents in need of services.
Benton County has made good progress in dealing with the addiction crisis. Our mental health crisis center opened last July. We are having challenges expanding our hours beyond the normal work hours and days of the week. Part of the challenge is the competition for qualified counselors. And the reimbursement rate model has changed in the last year. Even with these challenges, we are planning on expanding our weekday hours this spring. The restarting of Benton County's drug treatment court, thanks to Judge Demarest, will help hold people accountable with addiction issues. It has worked well in the past, and I'm very glad that we are able to get this program up and running again. Another gap in our treatment options is our current jail. Because of its very small capacity, we are sending adults in custody, AICs, to other facilities where friends and family have a difficult time supporting the AIC. Because of the lack of jail space, Benton County has a difficult time delivering services such as counseling, including addiction treatment and recovery programs. With a modern and larger correctional facility, we can do a much better job delivering these badly needed programs.